Mallory Kuivila is an active 17-year-old high school senior, an honor student, a runner, and a golfer.
I like to play golf. The peacefulness about it.
Mallory makes golf look easy, but life didn't start out so easy for Mallory.
She was born severe to profound hearing impairment, and we had her implanted at 2.5 at UH. We were one of the first 3 done that day, and it's been great.
University Hospitals has completed its 500th cochlear implant, one of only a handful of hospitals across the country to reach that milestone, allowing kids like Mallory to enjoy childhood.
Yeah, I know I'm different because I have hearing impairment, but I feel I'm with the other students and people because I'm like on the same level as them and not as difficult to talk with them.
So you actually lowered some of your responses, and that's nice to see.
Mallory has worked with audiologist Dr. Gail Murray since she was 18 months old, receiving the implant at 2.5. Now she's on her 4th version of the processor, the microphone and microprocessor behind her ear.
Say airplane.
Airplane.
Not only the most technologically advanced, but much smaller than the first.
It was a box. It was about the size of a cigarette box, and she had to wear it either in a harness or in a pocket or clipped to a belt, and it had a long cable.
Different from a hearing aid, which simply amplifies the sound, the cochlear implant works like an artificial human cochlea, with the microphone behind the ear sending sound directly to the brain.
The earlier implants really were only able to, in essence, give perception of one pitch. The newer implants, as time has gone on, have been able to expand and represent all the frequencies that humans use.
And despite all the advancements over the first 3 decades, University Hospital's Case Medical Center is working to make the implants even better, doing research to help advance the technology.
Within the next 5 years, we're going to have clinical trials of the first totally implantable cochlear implants. In other words, the microphone is housed within the ear itself. The battery is under the skin or somewhere, much like a pacemaker is put in for somebody and they have an external charger that can happen transcutaneously. And the programming device and the chip has been miniaturized and is housed within the internal component.
The implant has been around since the 70s, but Mallory was one of the first children to receive one when university hospitals helped prove infants and toddlers would be able to learn to talk using the device.
I think it's shaped who she is, really. It's made her stronger, and I think it's made her just have absolutely no trepidations about anything. She'll just face it head on and, you know, I want to do this or I want to do that, and she just tackles it.
It is absolutely phenomenal technology. To be able to restore hearing to someone that otherwise, you know, wouldn't be able to hear is definitely a privilege.
A privilege Mallory appreciates.
I'm going to be an audiologist. I think I already know a lot about it with my own experiences, and then I can help others get through and use examples from my life and help them get through. Well, part-time golfer too.